Hello and welcome to the Patient Educators Update, where we talk about patient education in a clinical environment. I'm Chuck Jones with Synergy Broadcast, and we're joined today by our expert, Fran London. Hi, Fran.
Hi, Chuck.
Fran is the patient education specialist at Phoenix Children's Hospital in Phoenix, Arizona, and she's also the author of the book, No Time to Teach, the essence of patient and family education for healthcare providers. And I'll hold it up here so you can take a look at it. And we'll have more information about the book as we go on in the show. Fran, we did an episode actually a few months back, and we talked about teaching priorities, and we only covered one of the topics. And I just am in the process of publishing that topic, and I thought it would be appropriate to follow up on that with the other things that are in there. And this comes from the summary in your book, where you talk about teaching priorities. And what you say is that you must focus on teaching the behaviors and skills related to the highest priorities: informed consent, self-care, how to recognize problems, and how to respond in answering questions. And we covered informed consent. So today what I wanted to talk about was how to teach patients to recognize problems and then know how to respond. And the reason I wanted to do that and why I think it's important is because I think this is a big reason behind high readmissions. Would you agree?
Absolutely.
Okay. And in thinking about what are some of the causes for this, for high readmissions, and thinking through the patient education kind of profile that you and I have talked about, I think that if we track back through, if we ask the question why 5 times, here's where we come out. That the reason for high readmissions is caused by inadequate patient education and discharge preparation. And that's caused by many nurses thinking they have no time to teach because they have so much to do, which is caused by the administration not making patient education a priority. And that is created from thinking that administration may not see the value in patient education because it's difficult to measure and it has no revenue directly associated with it. Does that make sense?
A lot of sense.
Okay. And in thinking about the lack of revenue, it's true that you can't make money off of patient education, but you can save money off of it because there are studies are starting to pop up on a fairly regular basis that associate patient education with cost savings. And we talked about one of these a couple of episodes ago where they use the term patient activation, which is basically patient education. And they said that patients who have more knowledge, skills, and confidence in managing their medical care have better outcomes. The study that was done found that those patients who were not educated, it cost the hospital between 8 and 21% more to care for those patients than those that were educated. I don't know about you, but 21% to me is a lot.
And that's huge.
Yeah, and even in the tight margins that we're operating on nowadays, 8% is a lot. So there's clearly a way that patient education can benefit the hospital. Obviously, it benefits the patient. And so let's focus today on one of your teaching priorities, which is how do you help the patient recognize problems and then know what to do when things happen?
Well, I just want to add one thing to what you've said is that if you ask anybody in an emergency department who works there what they see, clearly what they see are patients who were not taught how to recognize problems and how to respond. So what they end up doing is going to the emergency department. So even if they're not readmitted, they're often treated in an emergent situation because they weren't prepared.
That's interesting. So there's anecdotal data right within the hospital that supports this then.
Yeah, ask anyone who works in it. I know for a fact that in a pediatric hospital, we get a lot of people bringing their kids in with fevers. Mm-hmm. Some fevers are a sign of something horrible going on, and some fevers are just fevers.
Right.
So people really do need to know how to deal with that. Mm-hmm. So getting back to the question of preparing the patient, certainly any nurse who's taking care of a patient in a hospital knows what they're assessing, what they're looking for, what problems they're hoping to find early so that they can intervene before they become big problems. Those are the things that you need to teach the patient, because those are things that could go wrong at home too. So if you're looking for signs of infection, or if you're looking for side effects of medications, those are the things you need to also, while you're doing it even, tell the patient what you're looking for and that you're not finding it. But if you do find it, what you would do to intervene. That's taking advantage of the time you're with the patient to actually do the education that they will need to go home with.
Yeah, and obviously with each diagnosis or procedure, there are specific things that medically you're going to look out for that are going to be a problem. With surgery or something similar, infection is going to be a big deal, and there are specific things the patient can look for in that, right?
Exactly. And they're different for each kind of procedure and each kind of patient.
Okay. Now, the best time to do all this is right before they're discharged, right?
The best time to do this is throughout hospitalization. If you're going into the room and checking to see if their fever is rising, talk to them about why you think their fever could rise, and tell them what that means and how you would respond. I mean, it's just part of the conversation so that they know you're going in there for something.
Yeah.
And you're not just wandering around. And it shows them that you're working. It helps them prepare for going home. It helps them think about what's going on and gives them more time, if you do this throughout hospitalization, to formulate questions and ask, how high of a fever is a concern, that sort of thing.
Yeah. Well, how do you know at what level to address the issues with the patient? There are bound to be patients that don't even know what the proper normal temperature is and what a high fever is.
Exactly. So again, that goes back to the whole process of assessment and finding out what the patient already understands and knows. Do they have a thermometer at home? A lot of families don't even have a thermometer at home because they just don't.
Yeah.
Until you need it, you might not have it.
Right. What's the best way to, as a nurse educator, to feel comfortable that the patient understands what you're talking about?
Once again, teach back. Certainly summarize periodically, asking them, what is it that you're going to be looking for? What is it that you would do if that happens? Who would you call? Those are all important questions to be asking continuously to make sure the patient understands. If the patient is not capable of participating in this, certainly family members can also look out for side effects of medications or signs of infection that they can intervene with.
Yeah. What about what should they be talking to the patient about in case they have a concern? Should they run back to the emergency room or should they pick up the phone?
That's another key teaching in this, preparing them for discharge. They need to recognize what the problems are and then how severe each one might be and how to respond in terms of, is it something that they just take a medication, they just observe, or should they actually call the doctor if this happens? Should they call the doctor right away, or can they wait until morning? Or do they need to rush to the emergency room if this happens? So they need to understand how to recognize the signs and specifically how to respond to each of the signs appropriately, because there will be some readmissions that are appropriate.
Sure.
And you want that to happen. You don't want them to die at home because
yeah, exactly. Yeah.
You want them to recognize when something horrible is going on, but you also need them to recognize signs early so that if it's something that's just brewing, they could call the doctor and perhaps get a medication to treat it early and not have to have that readmission.
Yeah. Yeah. So it sounds like, using your no time to teach philosophy, that you do the assessment and the teach back early on to find out what they know, and you educate throughout the hospital stay. And then either just before discharge or perhaps during discharge, although they say that's the worst time to do any kind of education, you've got to have a handout or something that you give the patient that gives them some specific things to look out for, phone numbers to call, things of that nature, which I guess, you and I would talk about just discharge activity, but other people would call it patient education. But it's not.
Right. Well, the phone numbers are important too, because especially people who have lots of providers with lots of specialties, they need to know which one to call for what.
Yeah, sure, and that's important because as we've talked about, my wife is diabetic, but when she was in the hospital for surgery, some of the medication that they gave her said this may interact with your blood sugars, and you may spike or have a low blood sugar, and so if any of those things occur, then call your endocrinologist, and then they will call us, and so on and so on. So yeah, I can
Exactly.
see, yeah.
That can get pretty complicated.
Yeah, it can. Yeah, and for those of us who never went to medical school, and those that don't know how to read a thermometer,
Right.
it can be a real problem.
Yeah.
Yeah. Okay. So, are there one or two tips that you would tell the nurses out there right now that they should focus on when it comes to helping the patient understand potential problems?
Well, take advantage of the time when you're doing assessments. Take the assessment as a cue for you that is what you need to teach the patient to also be able to assess if that same problem could happen at home, a fever or whatever,
Right.
side effect of a medication. So take that time to also tell the patient what you're doing, what you're looking for, and if this should happen at home, who they should call or what they should do to intervene. So it's really just being aware as you're in the process of taking care of a patient, what you're doing and how this might impact long-term discharge.
Okay. Excellent advice. That's good. Why don't you tell folks where they can find you online, where they can get more good information like this?
Well, I've got a blog at www.notimetoteach.com, and I'm on Twitter at NoTimeToTeach.
Okay. And you also have a book. We mentioned it earlier. It's called No Time to Teach, and it's available wherever books are sold. On Amazon, you can get it both in paperback and in ebook form. And for those that would like to use your book as a support for in-service, they can go directly to your publisher, Pritchett and Hull, and their website is p-h.com, and for a bulk purchase, you can get up to 40% off, which is a terrific savings. And for those out there that would like to take their hospital patient education to the next level and add video to support the other things that you're doing, you can learn all about video and video on demand from our website, synergybroadcast.com, and our video on demand system we call MMDS, or Medical Media Delivery System. So, Fran, with that, I want to thank you very much for your time. I think it's great advice, and I'll see you next time.
Okay, bye, Chuck.
Bye-bye.